Welcome to the session on learning from program interventions. I think many of us have the experience of learning from case studies, and I know in my career at USAID and working in research, it definitely has been the case that case studies help you to understand linkages among different factors in a much more interesting way than kind of PowerPoints and bullets. So I'm Emmy Simmons. I'm a member of the Conference Advisory Committee, former USAID, as I said, and now working with both ILRI and IITA on their programs in Africa. We have four speakers today, and I won't introduce them other than just to give their names and what they're going to be talking about. And we are going to follow the order in which they are listed in your brochure. You all have conference bios, so should you want to follow up on their specific backgrounds or get in touch with them, you can go to that source. Victoria Quinn from Helen Keller International will be talking about homestead food production and nutrition education. Milton Rondolfio will be talking about homegrown school feeding as the coordinator of International Actions Against Hunger in Brazil. Tom Arnold, on my left, for the CEO of Concern Worldwide, will be talking about realigning agriculture to integrate nutrition project, which is another homestead project. So I am flanked by the homestead agriculture and nutrition projects. And our last speaker will be Grace Marquis on the role of animal source foods and an experience that she had working with the Global Livestock Collaborative Research Support Program supported by USAID in Ghana. I have asked each of the speakers not only to tell their story, to kind of lay out the case study, but to address the question of learning. Because learning is more than just doing. I'm sure many of us know about development projects that started with somebody saying, I have a really good idea. This has worked in someplace I was before. Let's just do it here. I'm sure it'll be fine. And it's kind of the trial and error approach to development. You know, it looks pretty much like it should work here. Let's do it. I've asked the speakers if they could sort of help us understand kind of the analytical models that they were using at starting out, and specifically how they, at least at the project outset, saw the linkages between agriculture, health, and nutrition. I've also asked them to talk a little bit about how their organizations came up with the experimental designs they used. How did they actually choose where to situate the program intervention? How did they choose the partners to work with? How did they choose the particular target populations? Another point, of course, is to bring out sort of no project is done overnight. As the projects went on, as the program interventions went on, what kind of learning occurred as the projects happened? And how formal a process was that? Was there a specific monitoring thing? Was it consultation with partners? Was it village observation? Was it strict measurement, for example, of expected impact? And then finally, sort of helping us to understand this learning process and its implications for sustainability of the program intervention itself or of the impacts that it had achieved. So I want all of the speakers to tell their stories, and I want them to help us understand how those program interventions linked agriculture, nutrition, and health. But I also want them to help us understand how they approached it in a way that I think contributes to all of our learning about similar kinds of interventions that we may be involved with or considering or supporting. So with that, let me just kick it off then with Victoria Quinn from Helen Keller Institute. Thank you, Victoria. And you have 10 minutes.
Yes, please. Hello, good morning, everyone. My name is Victoria Quinn. I'm with Helen Keller International, and we're an international NGO with our mission to save the sight and lives of the most vulnerable people in society through evidence-based health and eye health and nutrition programs. We're very much involved with the health sector and the education sector to address malnutrition, but we have had a lot of experience also in the agricultural sector, and that's the story I'd like to share with you today. We're working in the area of homestead food production, and just to start with, the objective of our work in this is to improve the nutritional status of vulnerable members of low-income households through home production of micronutrient-rich crops, such as vegetables and fruits, and small animal husbandry and poultry production. Up to the present time, the focus has been pretty much on micronutrient deficiencies. That focus in recent years from our learning, from our monitoring and evaluation, has been brought in to now address child growth. I just want to emphasize that these projects aim at producing year-round production of these micronutrient foods in the households and building on local knowledge and local farming techniques and local crops. We've been working with IFPRI recently, and through this work we can identify 4 major impact pathways to achieve nutrition, and we heard some of these in the previous session. The first impact pathway is through increased household production of these foods. The second impact pathway is through increased income, through the sales of surplus production. The third impact pathway is through increased consumption of these foods through nutrition behavior change. And the fourth impact pathway is through improved health via stronger links with health services. To tell you the story of how we begun, over 20 years ago we started out, and we have some colleagues who were involved in those first programs, so they can give you technical details during the question and answer sessions. But we now work in 4 countries in Asia-Pacific region. We just launched the model in Africa with IFPRI and Burkina Faso, as well as in Tanzania with assistance from Irish Aid. Cumulatively speaking, in Asia, we've covered more than 5 million people, reached them directly, but in fact, we've reached many more millions indirectly through the surplus of these foods found on the local marketplace. The program is very much gender specific to empower women in their role in the households, not just as food producers and household carers, but also as the primary nutrition caretakers for children. I've provided a 2-pager on some of the seats. Hopefully you're not sitting on it, but it'll provide the detail of the program, and basically HKI does not implement directly. We provide technical assistance to government partners and local NGOs. We've worked with over 200 local NGOs in Asia to date. We provide assistance over a 3-year period. Thereafter, we pull out and the local NGO continues for a bit longer. The basic model is establishing village model farms around which there are groups of farmers or mothers clubs that are formed, about 2 groups per village model farm of about 20 families each. And through this mechanism of the women's groups, mothers groups, farmers groups have different names depending on the country, the provision of inputs as well as agricultural training takes place. Linkages to markets are made if necessary, and also nutrition behavior change and health service support are made through these groups. There are many citations of the literature of where we've written about our results contained in the 2-pager, which I'm hoping you're not sitting on. And some of the results that we've shown in the past as being a consistent improvement in household production of these foods and in household consumption of these foods, particularly for the vulnerable members of the household. There's also information and evidence that shows income levels have been increased, especially income under the control of women, which is very important for nutritional outcomes. And also women's role within the household, as reported by themselves, seems to have been strengthened. There is also some evidence on health outcomes as well as outcomes in regard to micronutrient deficiencies, particularly reduction in anemia rates and reduction in night blindness. As I mentioned earlier, the focus has been very much on micronutrient deficiencies. We're widening that focus in the future based on our learning from the monitoring and evaluation, and we will be looking at impact on child growth in the future. Also, Millions Fed, the IFPRI-led initiative, identified Helen Keller's program in Bangladesh as one of the few models of agriculture and nutrition that has successfully been shown to improve food security and nutrition at the family level. Sustainability is important. We've done some studies that have showed that the vast majority of families, well after the program has ended, still maintain those practices. We did a rough costing of the home gardening component, and over a 3-year period, we estimated the cost to be about $9 per family over the 3 years. And working with a capstone team from George Washington University, they did a cost-benefit analysis that showed the economic rate of return for the home gardening portion to be 160%, which is quite robust. Some lessons learned. Well, we know from the variety of programs where we've adapted this model in urban, peri-urban and rural areas that it's very adaptable. It's very much based on a local assessment and analysis of the situation before the program is designed, so that builds in the adaptability. One key lesson we learned early on is that home gardens didn't quite do it because the bioavailability of some of the key micronutrients, in this case beta-carotene that's converted into vitamin A, was not so great in fruits and vegetables. Therefore, we added animal source foods to the mix to ensure that we did have good micronutrient-dense foods as part of the program, and we changed the terminology, and hence we use the term homestead food production. As we heard earlier today, Per Pinstrup-Andersen said it very eloquently, food production is not enough to improve nutrition. We really need to look at the underlying factors of food, but also the care of children, dietary optimal nutritional practices of the care of women and children, as well as health. So we've learned in HKI that we have to have a good balance of food, care, and health in our program design. Therefore, in moving ahead, we've also learned, and also through our work with IFPRI, to strengthen the links moving forward with health services. We've expanded the nutrition support to embrace the 2008 Lancet Nutrition Actions. We call them the Essential Nutrition Actions, which also incorporate state-of-the-art behavior change, and we hence now call the program the Enhanced Homestead Food Production, or to roll off the tongue, the EHFP. We certainly feel we need more attention in the future to address issues of water and sanitation, so that's very much on our radar. Some of the key challenges, there's simply never enough resources to do adequate monitoring and evaluation. We would love to do a much more robust job. We always do monitoring and evaluation. We publish a lot on it, but we would like to, moving forward, study what we think is a priority research item, and with IFPRI, we've identified establishing the nutritional impact on growth of this enhanced model as being a key priority. We feel this is really, really important to establish that. And with IFPRI, we've delineated the program impact and the theoretical background of what we're doing so that we can track over time what the inputs are, the processes, supervision, training, also behavior change, that lead to the expected outputs, the outcomes, and the impact. And so we use these program impact pathways by which to design our operational research and our monitoring and evaluation so we can track where bottlenecks are and we can correct these mid-course to improve likelihood of outcomes and impact. I've highlighted the orange boxes just to illustrate the consumption and health program impacts in this model. This is the model that we're using moving forward to retool some of our programs in Cambodia and to design our programs in Nepal and for the new programs in Africa. Again, pushing on the buttons of food, health, and care because I never let go of that one. We are testing the model in Africa, and we are trying now in Burkina Faso. We are obviously learning from this. There are severe water limitations that we will be facing, so we have to find ways by which to address these. There's also infrastructure and human resource limitations in some countries, and also very much fewer local NGOs with which to work. Challenges always reveal new opportunities, so we never let this overcome us, and we're looking for the way to best adjust the model in different contexts in different countries in Africa. I have 3 very happy-looking homestead food production chickens here, and I have 1 message per chicken. The first message is that the perception that women's gardening is not mainstream agriculture. Maybe I'm a bit sensitive about this, but this is the perception I have. We did some analysis of data produced by our participants in Bangladesh, and we calculated over just a 3-month period of the winter growing season that these families could, based on yield data, produce close to 100,000 metric tons of vegetables and close to 20,000 metric tons of fruits. And I would say that is not an insignificant level of food production that would have some impact on national food balance sheets. There's also, just to hammer again, this pervasive myth that family food production automatically leads to improved nutrition. You heard me say it before, but I'm going to say it again because I think repeated messages are very useful. And my last point really relates to the overarching theme of this conference, is what more can we do to leverage agriculture for nutrition? I specifically mean, who can do exactly what, exactly at what part of the agricultural cycle. Apart from homestead food production programs or biofortification programs or pro-nutrition agricultural policies, there's a lot more that can be done, we believe. And we had a little brainstorming group session last month in Washington with colleagues from John Snow Incorporated, where we elaborated what the agricultural cycle was, and we brainstormed all the various actors available for different phases in that cycle. We had vendors, farmers networks, we had agro dealers, ag extension agencies, and we did a matrix of who these people were, what the motivators could be for them to do more for nutrition, what they could do for nutrition, and what those messages should be. So this is work that yet remains to be completed, but we were getting very excited that there was a lot more that we could do to extract support for nutrition within the existing agricultural activities that are already out there. And on that point, I'd like to thank everyone for bearing with me for the presentation. I'd like to thank my colleagues and all our partners in the country, and certainly the groups that have funded us to do this work, and also my colleagues in IFPRI for providing me some of the slides. Thank you.